Hello, everyone. I see some faces from yesterday. It is my pleasure to be here in representation of my team at Bristol Myers Squibb. So with that, I'm going to talk about a project called Project RAIN. So what is Project RAIN? We aim to revolutionize AA integration into next-gen procurement. It's another way to make it like fun. I had a participation this morning where I talked about Matrix, the movie. And I said, I think AI is very cool for those of you that are here, but AI is not cool for those of our teams who are back. And the reason why it's not cool is because they feel threatened. So I'm going to talk to you about the process that was followed and that we're still following at BMS to do this revolution and to do a 10X. But I'm going to do a lot of pauses to talk to you about change management. And it is how do we bring our teams along into embracing technology. Before I take you there, I wanted to spend a little bit showing you who we are at BMS, because then I'm going to walk you through our story, and I'm going to show you how we're linking everything we do with our mission. Okay, so you're probably wondering, why is she showing me that video if I came here to learn about AI? And I'm showing you that video because I hope if one thing you walk away with is companies like BMS and many other pharmas exist to save patients' lives. And then you have procurement. So how do we make procurement relevant? If we are able to connect procurement and any enabling function with this mission of saving patients' lives, then it's almost like you go from being the one function that is the underdog to the function that can really help a company go exponentially. And this is what we intended with RAIN. We intended to link the mission of the company, saving patients' lives. You heard the words speed, efficiency. They pretty much correlate with everything that we are doing here, right? So I'll walk you through how we did this. Before I do that, I wanted to share the story. We have this practice at BMS, which is we talk about why do we come to work. And I come to work because my mother died of a triple-negative breast cancer, and I decided to join BMS because BMS has a partnership with SysImmune, who's developing a therapeutic area around triple-negative breast cancer. So I'm linking my own personal story with a patient, which is my mother, and I'm also linking my own personal journey at work with how we can save more patients. And this is how we bring teams along. So this is our journey. So first, we work a lot around like, okay, let's understand where we are. That was a very important step in our journey. We needed to understand the landscape of the systems, but we needed to bring teams along. So then we gathered a group of team members, and we told them that they were going to be the evaluators of these 24 technologies. So we look at 24 technologies. Then for those 24, we decided 14 were going to solve some of the issues that we had internally at BMS. From those 14, we decided to go with 10. And for the 10, we were going to do a pilot. We were going to do a test. We were going to bring people from IT, finance, and the other functions to do a deep dive, looking into the tool. And then from those, we went with 4 for phase 1. And I'm very pleased to announce that by the end of October, those 4 will be implemented. And then we left the other 5 for next year. And then how do I get back this to the patients? The teams were the ones who were doing the pitch to me, and they were doing the pitch to my leadership team. So that means we were moving teams from, they didn't want to do this because I'm going to be replaced, right? To I am the one who has to be convinced, because now I have to convince my CPO and my leadership team into which ones do we implement. So they were doing the pitch, and they were telling me which ones they wanted to be implemented. With what? With the patients in mind. So they needed to link a tool that could save patients, more patients, so speed, and then faster. So we went and looked at an assessment of everything we had in procurement. And what I found here, and this is very relevant to companies with high margins, you have the Cadillac of everything. And you sometimes have 3 Cadillacs for one solution. For our TPRM tool, we have 3 tools. And in some of them, we were not even utilizing the latest release. So then we look at vertically every one of the processes, right? And then recognize that we had multiple solutions for some of these processes, that some of these processes were like what I call my team 1980s. We were using and doing things in the 1980s. We also have a lot of the systems, as I mentioned before, that were not in the latest release. So even with the best tools, we were not using the best capabilities. Then we did a lot around communications. How are we communicating within the supply chain of procurement? How are we communicating between the person who needs something, the person who's going to get it, the supplier who's going to get it to you, and the one who's going to pay for what you're buying? So how was the communication broken? Then the organization. Was my organization, my procurement organization, ready to embrace the next technology? Did I have people in place that wanted to do this? And what I found is I had many what I call towers. So I have my R&D tower, my commercial tower, my enabling functions tower, and each one of them were replicating the same processes. So each one of them had a tactical buyer. Each one of them had a TPRM owner. Each one of them had a change management agent. So then I was also looking at what do I need to do in my organization to enable an agile process. Out of that analysis, I did a whole reorg in the structure, and we created what is called an agile sourcing team, which is basically a team. It's similar to what you do in a shared service organization, where we put all the tasks that were repetitive, we put them on a team, then we did a geolocation strategy. And this is where it gets beautiful. The promise back to the company, this is where the ROI is super important. The promise back to the company was insourcing from a third party, taking it in-house with 50% of the FTEs. But I said, but you will not get the delta of the money, because I'm going to self-fund every technology. And moving forward, I plan to self-fund every technology I bring to make my process better. So that means that I am already 10xing my team. And then in the future, Alan, who's helping me and supporting me, gave me an idea this morning. Maybe I should have like an org chart where I show all my team, and I show like all the bots, all the agents, all the artificial agents in the back. And I think that I'm probably going to do that. It's going to look so cool. It's going to look like the Matrix. The culture. So this is a culture. So I joined less than a year ago, and I was very lured into the culture. It's called the BMS Nice. We're so nice to each other. It is probably the nicest company you will go to work for. And it is so nice at the beginning because they're all so nice to you. But then I don't know if you realize this, but niceness and operational efficiency don't go around. You need to be able to have positive conflict. And I found teams that were not trained to positive conflict. So how do you train teams to do that? Well, you give them data. Because when you work for a company where you have scientists, when you bring data forward, then there is almost nothing to be discussed. Then it's not personal. The data is telling you where you need to go. So we empower them and we say we're going to change the culture, we're going to change the way we work. And then around technology. And here I want to pause for a second and say, if we have any IT leaders in the room, and those of you that are looking to work with your CTO and your CIO, have them talk to mine. Because what he did was brilliant. I went to him and I said, this is a journey I want to take the team on. I want to have this exploration. What role do you want to play? Do I wait until you go and discover technologies for me? And he said, no, I don't have time. Because I have to go and deep dive into clinical studies, right? More patients, faster. I have to go and look into manufacturing processes because we need to make medicines cheaper. So go and do your own discovery. Just bring my team along to make sure that when you're doing the decision making, you are doing it with the right mindset around data, data structure and architecture, security, etc. And I talked to many of the CPOs, and I think that's a big problem that we're having. And it is IT is trying to lead the way for AI. And I think Matthias mentioned that he has 170 suppliers here, and I believe there were less last year, and then I don't know how many are going to be next year. It is impossible for an IT organization to be upfront with so many choices. So my call to all of you that are trying to see how do I revolutionize my company, you're going to have to do it yourself. But bring IT along. Give them the credit. Make them part of the selection process. So that's how we did around technology. So we evaluated some potential use cases, and we said that it's just, if you look at some of you might think of the 7-step sourcing process. There are so many areas which we'll be looking at. And we said, there is no way we can do that. So we paused for a minute, and we said, okay, we're going to select 3 areas that save more patients' lives faster. And this is how we picked the 3. So first, we went around forecasting and value capture. Why forecasting and value capture? If I'm able to forecast what I need, and I can get it faster, that means that my scientists are going to get whatever they need faster. My clinical trials are going to run faster, and then we're going to get to the patients faster. The next one, project intake. One of the biggest challenges that were posed to me by the end users were, it takes so long to buy something. I don't even know where to go. I don't know who to talk to. I go to someone in your team, and they send me to someone else. And then they send me to an SOP. And then I have to do this training. And then I use this system. And then next year, when I go back, I'm already locked out of the system. So, okay, project intake, in service of whom? In service of the scientists, which are our end users, because what we want them is to do what? To spend more time doing discovery so they can save more patients faster. And then the third one was around strategic and tactical sourcing. Why is it, and then you were going to say, how are you going to save patients there? Okay, hope everyone is okay back there. So on strategic and tactical sourcing, it was all around, I have too many of my team members that are spending so much time here, and I need to free them up so they can have time to learn the new technology. So this one was a little bit of the selfish one, because I said, if I want them to embrace the technology that I'm already, telling the others they need to adopt, how do I get my team? I'm going to make their life easier. So let's talk about the clinical trial. I'll do a double click there. For those of you that are not familiar with pharmas, all the process when you're doing clinical trials, from the discovery to the moment you get approved by the FDA to the moment you go to commercialization, depending on the company you're talking to, it takes anywhere between 7, 10, sometimes 12 years, right? Now, the biotechs are doing it much faster than what they're getting acquired by pharmas. And so that's a huge problem that we have. Why is that a problem? It's a problem of both economics and patients' lives. Why economics? From the moment you file a patent, you have 20 years. So if you take 12 years getting that medicine to the market, you are getting only 8 years for the company to recoup all the money they put there in order to give the medicine to the patient. So that means, what are they going to do? Have a higher price so that they can recoup that. Now, if you can do it in 6 years, you have 14 years to sell the drug. Right there, you save 50% of your ROI economics. So all of this is around economics, and I know I keep talking about patients, but I also know that we are in business to make money. So I think it is a combination of how do we link the journey into this. So for clinical trial, we say we're going to double-click on clinical trials, and we're going to see every process of procurement, all the way from the beginning, right? From the filing, how we deal with lawyers who are doing patent filings, how do we contract with this, how do we contract with molecule acceleration, and we're going to look at each one of the pieces of the clinical trial where there is a procurement process. And we're going to enable those, and we're going to measure those, and we're going to make them faster. So we finally decided for 4. You're probably asking, okay, you did all this work, and where did you end up? So we decided on a tool. I'm not going to disclose names, because then it would be disservice for the others that I have on the pipeline if I don't disclose them. But if you're curious, feel free to ping me. I'm happy to tell you our journey. So we did a procurement pipeline management tool that we're going to go live, again, all of them by the end of October. An AI-driven sourcing, you're probably already thinking the names. Autonomous negotiations, I talked about it this morning, so you probably can put a tag, go in the agenda, you know who I'm talking about. And then procurement orchestration. And if you leave out of this room with something, I hope that you are able to tell someone that I chose those 4 based on what? More patience, faster. And then, what were the lessons learned? The first one is, you have to embrace innovation and change. And for me, it was easy, because it naturally comes to me. I think you heard in my introduction, I've been in multiple companies. And that gives me that idea of like the new and embracing the new. Well, when you go to a company with most of the people that work for you have been 20 plus years in the company, then you need to have them embrace innovation. Bringing them along, then you can go faster. The second one is losing the fear of failure. So one thing that we took out of it is we didn't disclose how much the tools were going to cost. So that was not a parameter for us to choose a tool. Why did we do that? Because we have procurement teams. We didn't want them choosing a tool based on like which one is going to be cheaper for me, but choosing the one that was going to be right for us. And then we told them we're going to fail fast and pivot. So we went 24, 14, 10, 9, chose 4, 5 line up, and then I'm walking away from this, and I already have 2 more that I want to implement. So that's and you do it fast. It is actually the economics play very well. The ROI is there, and I find these technologies compared to, if we have someone from SAP close, cover your ears. We go from paying multi-million-dollar agreements for an SAP to less than $100,000. You can have some of these technologies activated. So what is the future of procurement for BMS? And I'm hoping one day I'll come back to you and I'll report on whether everything I told you today about patients, and I can give you maybe some stats in the future. How much faster are we going to patients, right? And how many hours or days or maybe years we took away from clinical trials, is that we're moving from transactional to transformational. And this is super, super important because I mentioned it before. I joined and I found an organization, I call us the underdogs, that was doing a lot of processes, a lot of systems, repetitive, not really nailing to the point. And I am, as a leader, I have a dream where my organization is going to be recognized for the organization that's going to 10x in terms of number of patients that we can get to. So with that, thank you very much.